In this podcast, Dr. Ken Alibek discusses how children with autism can be helped when they experience gut problems and whether these issues can be treated. He explains that focusing solely on the gastrointestinal tract is often not enough, as many symptoms may also be linked to systemic inflammation and inflammation affecting the brain. Dr. Alibek shares his insights into the complex connections between gut health, the immune system, and neurological function, offering a broader perspective on supporting children with autism.
What can we do about that? Is it possible to help those children? Like, if treating those pathogens can bring the speech, can help with behavior. Lots of children have aggressive behavior and in general cognitive function.
No, it's not going to do this. It's not going to work this way because as many parents know that they've gone through different protocols, nemetic protocols, some other protocols, and just many things focusing on the gastrointestinal tract. But nobody was able to get the child neurotypical after even a long-term treatment of microbiome. But the problem is, it's not just a microbiome problem. It's a problem of inflammation in the brain. Let me say, in this case, treating microbiome wouldn't result in any significant improvement in the brain. But it must be a part of the treatment, because if we treat just the problems in the brain without paying attention to what's happening in the gastrointestinal tract, it wouldn't result in the recovery either. That's the case. In this case, when we talk about the treatment, it should be comprehensive, focusing on the sources of inflammation, which are definitely, it's in the brain, it's in the gastrointestinal tract. Sometimes we can see some sources of inflammation coming from the urinary tract. I mean, just in this case, the treatment of autism is not the treatment of one particular thing. We need to treat the entire body. We need to treat the infections, inflammation, and immune system dysregulation. This, and it should be done simultaneously. There are many other mechanisms. Okay. In this case, when we talk about what should be done with such a microbiome.
Is there a magic supplement or herb?
First, because when we have a wrong microbiome, the parents are using probiotics, all the things, let me say, nothing happens. Constipation, diarrhea, intermittent states, let me say, gas formation, all the things, they're not going away. But the simple logic says, okay, if we have something wrong here, what should we do? We need to remove it first, then replace, correct? With normal bacteria. Because the microbiome is a system in which it will never be empty. If people think, okay, we use antibiotics, and after using antibiotics, we're going to destroy microbiome, no, it's not destroyable. What's important, let me say, to reduce the load.
Destroy it and it grows other things. You destroy other things and it grows other things. It's always.
And that's what we do. We treat it for some period. We clean it up, and then we start using probiotics, for example, and just because there is some less kind of virtual empty space. I mean, the space is taken by probiotic bacteria. Okay, but we need to have a sequence of actions. First clean, and then replace, repopulate. This is the way. First, how it should be done.